right, big word time. Have you heard of endometriosis? Say that 5 times. I'm still surprised today at how many women have not heard of this disease and how often it's undiagnosed. Endometriosis is when the lining of the uterus, that's this organ that sits down in our lower abdomen and our pelvis, overgrows in response to our hormones. And that lining, another big word called the endometrium, becomes thick and difficult to shed. Now initially, it's not really noticeable. You might get a pain here or there, nothing to really even talk about, quite honestly. But over time, it builds and crescendos, and the pain becomes unbearable. And there's often breakthrough bleeding, pain with sex, pain with bowel movements, and it worsens into issues with fertility, gut pain, and overall inflammation. What's even worse, the same endometrial tissue can grow onto other parts of the body, and it can clamp down on those organs and cause symptoms in this whole lower abdominal cavity that again is so easy to misdiagnose. I've seen patients with endometriosis come in with the wrong diagnosis all the time, or dismissed as IBS or something else, just chronic constipation. Now, the management of endometriosis is often directed at just shutting our hormones down, shut the whole pathway down, or cut you up and get surgery to clean everything out. But I prefer to take more of an east-west approach to managing endometriosis. And this is a quick disclaimer, this does not mean you won't need surgery or you won't ever need a medication. But if your disease has progressed significantly, you still may need some of these conventional treatments. You still need, though, the east-west approach to control the spread of the disease and really get to the root of why this started in the first place. Here are the most common root reasons of endometriosis. The first is a hormone imbalance known as estrogen dominance. This is where we overproduce estrogen or we have overexposure to environmental estrogens. Second is inflammation. So chronic inflammation. Now that can be from a bad diet, that can be from poor gut health, that can be from extreme stress, but all of that can trigger inflammation and drive the growth of endometriosis. Next is high body fat. Now remember, anytime we have high body fat, we also have high visceral fat. Now that's the fat you can't see. That's the fat that lives on our organs. It lives on our liver, our heart, our stomach, our uterus. And that body fat, again, overproduces estrogen, causing, guess what? Estrogen dominance. Another concept I want you to really understand, big words again, I feel like this is the big word video, is oxidative stress. Now oxidative stress, I want you to think about your cells, and each cell is trying to rejuvenate, it's trying to repair, it's just trying to keep up, but over time it can't anymore because the body simply doesn't have what it needs, or you've put the body under too much stress. But all of that drives endometriosis as well. And last but not least is genetics. There are genetics for breaking down estrogen, there are genetics for oxidative stress, and their genetics that dictate whether you are at higher risk for endometriosis. So take a look at your family history. If you think you might have endometriosis, here's what you can do to control your symptoms and control the spread of the disease. First and foremost is talk to your doctor. You might need a pelvic exam and a pelvic ultrasound to look at that uterine lining. Your doctor might want, depending on the severity of your condition, they might want a laparoscopy, which is a surgery to confirm the diagnosis, and that's okay. Start with an anti-inflammatory, estrogen balancing diet. Let's talk about this for a second. An anti-inflammatory diet helps to balance inflammation, which remember is one of the root causes of endometriosis. So I do want you to lower things like gluten and dairy and sugar because it drives inflammation. And I want you to increase those good fats that we see in olive oil or some of the other oils like ghee or coconut oil because they help to mitigate inflammation. An estrogen detoxifying diet can also help endometriosis by clearing out the excess estrogen from your system. One of the first things to do with that particular diet is to increase your cruciferous vegetables. Cruciferous vegetables, remember, are your broccoli, kale, cauliflower, cabbage, Brussels sprouts. But what they essentially do is they take estrogen and help to chop it up into little pieces so your body can get rid of it. It's also important to get your other hormones checked because remember, all these hormones kind of play together on a chessboard. And your thyroid, for example, can affect your estrogen, and your cortisol can affect your estrogen, and insulin can affect your estrogen. So it's really important to understand how they're all working together in concert. It's also really important to lower your body weight and really focus on exercises that help you to lower body fat because that indirectly will help you to lower estrogen dominance. And last but not least, really increasing your intake of antioxidants. Now, these are the foods that are brightly colored. So think greens like kale and spinach, or your bright orange foods like sweet potato or carrots. Those are things that have a lot of great antioxidants in them, and that reduces oxidative stress. Finally, regulating your hormones and your pain using acupuncture, Chinese herbs, and Ayurvedic modalities that target endometriosis in a different way is really important. Ayurveda sees endometriosis as a buildup of toxins. They call it AMA, and the focus is on the cleanup of the liver and the gut, followed by something called panchakarma, which is a series of treatments using oils, massage, and a simple diet to clean up the toxins and calm the nervous system down. Have any of you guys tried that before? It's a wonderful treatment. Bottom line, endometriosis is a frequently missed diagnosis in so many women having pain, infertility, digestive discomfort, and inflammation. If you're suffering from any of these symptoms, talk to your doctor and follow the East-West approach to get the help you need. Check out my other videos to learn more.